cannot find it, stop what you're doing and then go back to it, okay? Because that will annoy the patient, and you might, you might do some more damage, okay? Because remember, why are they coming in already? They're hurt. There's an issue, all right? So you want to be careful about that, okay? All right. So that is with your palpation, okay? So we're going to do the goniometry now, okay? Now, in the book, in my lab manual, I have for elbow flexion extension, the position you should be in is supine, okay? Is there another position that I can actually measure goniometry-wise? Sitting, yeah, I could definitely do it in sitting, okay? Alrighty. Do I need to be more mindful, okay, of what their posture is or how they're sitting can affect emotion? Absolutely, okay? Now, if she was sitting in a chair like this, I could probably do her right side okay, alrighty? How comfortable would I be, by the way? Well, I would have to go over there, yeah, alrighty? But then what I would need to do, you think? Right? Yeah, I would have to line her up. Would I be able to be there for a prolonged period of time, you think? Can I be, I'm going to show it over here. Can I be like this for lining everything up? No. So supine is the ideal position to do it in, right? Is done in other positions? Absolutely, right? But you want the ideal position. If there's a reason why they can't get on the bed, right, then you do sort of need to go to that sitting position, and then you just need to sort of be extremely mindful of what a patient will do. Again, you guys won't do anything, right? Because hopefully not, right? But patients will, and they don't realize they're doing something, okay? Then it just becomes more work for you to either stabilize them or tell them, please don't do that, okay? And then sort of like putting you in an awkward position. Yes or no? Okay, so let's hop on the mat, Diana. Alrighty. Now, depending on the person's size of the arm here, really depends on which goniometer you're going to pick, okay? And if you have a child, you're going to go down to the 8-inch goniometer. If it's an adult, you can sort of stick with the regular 12-inch goniometer. Alrighty, so, and you guys going to need to come around here. All you guys come around here. Alrighty, alright. Okay, now, alrighty, using the landmarks, okay? You're using her lateral epicondyle as a fulcrum. You're using the forearm, her radial side of the forearm, as her alignment for the moving arm or the distal arm. Her proximal arm, alrighty, is going to be in line with the humerus, okay? Now, looking at this, does it look like she's at 0? Yes or no? You guys. You guys can say. Yeah. Is she a little bit more? Like she's in hyperextension? All right, so we're not going to worry about that. All righty? But when you're looking at it,
when you measure that, wouldn't you take that into account?
Yes, you do take it into account. If it happens to be a lot, a little bit more. Are you safe? You feel okay? You okay? Okay. All right, if I'm looking at it, where's your condyle? Your epicondyles right here. All right, line it up. Okay, it's right above the joint line. Alrighty, palm up. Okay, thank you. Alrighty. Alrighty, midline of the humerus. Don't use the muscle mass, okay? Alright, because everybody's muscle mass is a little bit differently. Alrighty, you're gonna use the midline of the humerus and use her greater tubercle to line everything up. So when you're looking at it, it does look like she's at 0. For her, she's at 0. Some people, depending on the muscle mass itself, if they have a really solid triceps, okay, that can make it look like she's in more hyperextension. To sort of fix that a little bit, what would I need to do so it doesn't complicate your reading?
A towel.
Get a towel, all right? For her, I'm okay. She doesn't need it, and you know what? She's exactly 12 inches to her radial styloid process, so that really works out well for her. So I'm going to line her up again. Alrighty. So, can you bend your elbow up for me? Can I see you do that? Looking at it, how much? Just approximating.
130.
130-ish. Okay, so we'll see. Alrighty, what happens? Okay, looking at that, what is it?
0.
0. Okay. Alrighty. So if I'm going to measure flexion, she would start in what position?
0.
Yeah, extended, in the extended position. Whatever. You can't be careful about saying 0 because it may not be 0 for her.
Oh, yeah, but for her it's 0.
For her it is. Okay, so you always want to start in the extended position. If I'm measuring extension, what position would I have her in? Yeah, flex position. This is very easy. This is the easy one when you're looking at it. Okay, so I'm going to line her up again. Okay. Yeah. Palm up. Good. Thank you. Alright, looking at it. Alrighty. Alright. She's like maybe 1 degree into hyperextension. She's 1 degree into hyperextension. So on the count of 3, can you bring it up for me? 1, 2, 3. Okay, go, 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 go. Alrighty, realign her. Keep going, keep going, keep going. Alright. Pulling her away. So she went from -1 to 90 to 40. Okay, so from 90, 100, 100,